Hello and welcome. I'm really pleased to introduce Mustafa Hassan, who is the General Manager at the Wood Green Community Diagnostic Centre. And we're going to have a dialogue around the program that we recently launched, Healthy Hearts Research Engagement Network Haringey, which is designed to support prevention by providing people with essential information and facilitating conversations that help them avoid illness or manage their health effectively when they do become well. So to have Mustafa with us today is a great privilege. Mustafa, really good to meet you. Hope all is well.
Lovely to meet you. Thank you very much for inviting us.
So Mustafa, um, we'll have a dialogue after. So you go ahead and tell us all about Wood Green Community Diagnostic Centre.
Thank you, Rudy. Hi, everyone. And welcome to the Wood Green Community Diagnostic Centre. We are based in the Wood Green Shopping Mall, and I'll just give a brief presentation just about what the Wood Green CDC is all about and what services we offer to our community in Haringey. So the CDC, a bit of background, this was a government initiative to develop and open community diagnostic centers all over the country. And the Wood Green CDC is one of about 165 in the country. And the Wood Green CDC was specifically opened in Haringey because of a dire need for bringing diagnostics closer to the community within Haringey, who have historically not had these diagnostic services close to their homes. We opened in August 2022 and set it up in the Wood Green Shopping Mall to provide an easy and equitable access for our community to diagnostic tests. And since opening, some of our key aims have been to address healthcare inequalities and addressing the issue with diagnostic capacity and increasing that through this community diagnostic centre. We have worked with our colleagues in North Central London through the Diagnostic Access Programme and UCL partners to try and use the opportunity with the CDC to do a lot of learning and evaluating the things we do at the CDC so that we can provide the best care possible to our patients in Haringey. Just a quick picture of where we're located in terms of the five boroughs in North Central London. So we're located within Haringey, right at the centre there, and the aim is to bring the diagnostics as close as possible to our community in Haringey. In terms of some of the services that we offer a wide range of diagnostic tests at the CDC to include X-rays, ultrasound, phlebotomy, so blood taking, ophthalmology, eye tests, MRI and CT scans, fibroscans for assessing liver disease, and targeted lung health checks. We're located in the ground floor of the mall, just a few meters away from Boots. We've tried to use the opportunity for the CDC to drive clinical pathways through it. So trying to improve the way patients are seen, diagnosed, and treated. Some of the clinical pathways we've been able to develop through the CDC has been a straight to CT pathway. So that what that involves is patients coming in for an X-ray, and the X-ray being reviewed whilst the patient is there. And if it's required, the patient can go on to have a CT scan at the same time in the same attendance, reducing the need for patients to go back to the GP and coming back again at a later date to the center to have a CT scan. So we want to try and bundle all the diagnostic tests all in one attendance. Sarcoma pathway. So this is a specific cancer pathway looking at soft tissue sarcomas, and this is working closely with our colleagues at the Royal National Orthopaedic Hospital to try and reduce the amount of time it takes for patients to be diagnosed for cancers. Targeted lung health checks. This is a clinical pathway we set up with our colleagues at UCLH, University College London Hospital. And the aim of that is to try and capture patients who potentially may have lung cancer as early as possible. So these patients would go through a screening program, and if required, would end up having several diagnostic tests like an X-ray and a CT scan to be able to diagnose lung cancers a lot sooner and improve the prognosis of the treatment. And also Rapid Diagnostic Centre in collaboration with our colleagues at the North Middlesex Hospital. And this again is another cancer pathway where patients with non-specific symptoms are seen in the clinic at the North Mid, and then they direct the diagnostics to us, and we can turn it around in a couple of days. And the results are sent back to North Middlesex for review and then a treatment plan going forwards. And again, the aim there is to reduce the amount of time it takes to diagnose cancers. And we feel that Wood Green CDC is an ideal place to be able to deliver these pathways and improve the outcomes for our patients. Some of the referral pathways and some information to give to our people in the community. X-rays is a walk-in service, and all that is required is a referral from your GP that comes through to us, whether it be handed to you in a paper form or emailed across to us. We can see you at any time as a walk-in service, and our operating hours for X-ray are between 8:30 and 6:30, and we're also open on Saturdays 9 to 5. This is generally the opening times across all our services, except for phlebotomy, which at the moment is only open from 8:30 till 4:30 on Monday to Friday, and Saturdays 9 a.m. to 4:30 p.m. We are exploring how we could open additional hours into the evening, which also helps improve the access for working people. I know it's very difficult for a lot of people to attend tests during the week whilst they're working. So we found that opening on the Saturdays was really important for them. And if we can extend the hours into the evening, that will even broaden the access for people attending Wood Green CDC. CT and MRI and ultrasound appointments are appointments only, and the referrals will come through your GPs or from the other trusts around us in the surrounding area. And those referrals will come through to us, and we will send you an appointment. We usually turn those appointments around within 5 to 7 days. You'll get an appointment in the post, and depending on how urgent your scan is, we'll then book you accordingly. I just wanted to focus in on blood tests because that's quite a highly used test that we have at the CDC. And I know a lot of people are referred through their GPs to have blood tests done. So I just wanted to touch upon how we want to explain how you can access the service. So we're using a booking system called SwiftQ. It's an electronic system which allows patients and GPs to make appointments for their patients to have blood tests done. It's accessible through this QR code and also the link below. And you are able to make an appointment at your convenience. We offer urgent appointments, same-day appointments if you require a blood test on the day. And we offer approximately 250 appointment slots per day, Monday to Saturday. So there's ample opportunity for you to be able to book an appointment within a short space of time. So we do encourage our patients to try and use the SwiftQ platform for this. This is just a quick section around how long it takes for the results to get back to your doctor. So for CT, MRI, and X-rays, we aim to try and get the results back as soon as possible. With CT and MRI, we aim to turn those around within 3 to 5 days of the scan being completed, and with X-rays within 24 hours. Ultrasounds, those results usually take about 24 to 48 hours to get back to your doctor. And phlebotomy results at the moment takes about 5 working days to be processed through the labs and get back to your GP. With all tests, it's recommended that you contact your referrer to be able to get the results of your scan. I wanted to touch upon the community engagement and how important that's been for us, and also in relation to Healthy Hearts. We wanted to bring the community into the conversation about how we designed the CDC. to make it work for them. We did a lot of engagement opportunities with some of the communities, and some of the communities we've done some focus groups with have been the Black Caribbean community, the Turkish and Kurdish communities, and the Polish communities in Haringey, supported by some of our colleagues uh, shown on the slide here. And what we've been able to really get from that is to understand how communication has been really important and how that's been quite a challenge for patients in accessing healthcare, how they would like appointments to be made in terms of a walk-in service or opening longer. And that's been seen as a positive thing when we've opened on Saturdays, particularly with those who are working people in Haringey. The experience that they have at the CDC, we wanted to make sure that when they do walk into the CDC, they get the best experience that they can. And we wanted to really take away the hospital feel from going into have healthcare tests. So the CDC really does take away that hospital feel and makes it a welcoming environment for our patients. Cultural awareness as well has been a key one for us. So we wanted to take some insights into what the community felt we needed to make sure we were aware of, and how we designed our CDC would be centered around that. And the key thing for us is building trust. We wanted to ensure we built trust with our patients in the in the Haringey community. We know that the Haringey community has been a community that have struggled with accessing healthcare for various reasons, lack of trust in healthcare services, and we wanted to build that trust with them. And that's been really facilitated by some of these focus groups, and communicating with the community leaders has been a really important factor for us. And what we want to do with this community engagement is for it to be a rolling process, that we're continuously engaging with the community, learning from some of the things that we're doing right, learning from some of the things that we're doing wrong, and then making adjustments and changes and feeding that back to our community. And what's been really important is attending some of these community engagement sessions outside of the CDC. So, for example, Healthy Hearts, who invited us kindly to their last event, really helped us express what we wanted to try and achieve at the CDC, and trying to tackle some of the health issues within the community, like diabetes and hypertension. Those are all different types of health conditions that need diagnostics and tests being done in quite a rapid process, and we're able to help deliver that and improve the health outcomes for our community in Haringey. And in conjunction with that, feedback's been really important for us. I think what we want to try and do is to have continuous feedback from not only our community, but also the GPs in the community as well, on how easy it is to access the service. Are there any challenges that they've experienced? So that there's a continuous learning process as we go on, as we're open. So these are some of the ways you can contact us. So you can either contact myself or my colleague Michael, who manage the services at the CDC, and we're happy to have a conversation with you about what we're doing well and what we could improve on. And we want to try and engage with our GP practices a lot more as well, to learn about how we can smooth out the process with referring patients to the CDC. There is an opportunity also to do an anonymous survey via the link in the presentation here today. And if you feel like you would like to, please do give us some feedback, and we're more than happy to meet with you if you'd like that as well. And we've just included in the pack here just some information about some key people within our team, the management team at the CDC, who you can contact if there's any specific queries or concerns that you may have. For general queries, we have a general email address, which is monitored daily while we're open. And there's a contact number there to our team, who will be more than happy to assist you. And that's it. Thank you for allowing me to share that presentation there, and I'm happy to answer any questions.
Thank you very much for that, Mustafa. And so in terms of the public, there's 5 big areas that you did cover: early detection and prevention, reduce hospital pressure, convenience and accessibility, faster diagnosis and treatment, health equity, and inclusion. So from the member of public's perspective, can an individual be seen at the CDC if they don't live in Wood Green?
Yes, they can. We are open to patients all across North London, and we've got our digital connections with all the GP practices in North Central London. And we are also seeing patients outside of North London as well as part of our sarcoma pathway at the moment. That's a wider London pathway that we're delivering through the CDC. So there's open access to all our patients in North Central London, and particularly those patients in Haringey.
Okay, so the other boroughs, of course, being Barnet, Islington,
Enfield
Enfield,
and
and
Camden.
Camden.
Yeah.
Okay, that's excellent to hear. So again, if we have many people from different backgrounds, so if there's an individual who English is not their first or preferred language, how do you deal with that?
So patients who have where English is not their first language are welcome at the Wood Green CDC, and we're able to support them with an excellent interpreting service that we share with the Whittington Hospital, and we're able to make an appointment with the interpreting service to make sure that there's an interpreter who speaks the same language as the patient at the CDC. We also have a diverse team at the CDC. Our staff speak a sort of a multitude of languages, and a lot of it is representative of our community within Wood Green and Haringey. So we feel very confident that we're able to support people who feel that English is not their first language, in them understanding why they're there and what we're doing and how we can help them.
You did mention the opening and closing times, and maybe that you could just take us through that again.
Sure.
But the key question would be, is it a walk-in service?
So, firstly, we're open Mondays to Saturdays. Monday to Friday, we're open long hours. We're open from 8:30 till 6:30 for the majority of our services. And then on the Saturdays, we're open 9 till 4:30 across all our services. So we're open 6 days a week. The only walk-in service that we have at the moment is our X-ray service. So that's available for our patients to walk in. But for all other tests that we deliver, CT, MRI, ultrasound, ophthalmology, and blood tests, that is an appointment-only service. But what I'd like to stress with the blood test service in particular is that there's not a long wait for blood tests. So you could book an appointment on the same day that you get the referral from your doctor. We have ample capacity available on the day for you to come in and get your blood tests done.
Thanks for that. And how does an individual get their results?
So the results will go back to your doctor who referred you, whether that be your GP or if you were referred from a local hospital around the area. The results will go back to your clinician or your doctor, and that's where you discuss the results with them. If there are any concerns about any delays with your results getting back, please do contact your referrer in the first instance. And then they will be able to liaise with us and we can organize the results to get back in a timely manner. But at the moment, we have a great turnaround time for our results at the Wood Green CDC, and patients are being diagnosed and tested as in a timely fashion at the moment, which is a really good thing for us here at Wood Green.
Excellent. And just before we close, if you could just remind everyone in terms of the address and telephone number.
Yes, absolutely. So the Wood Green CDC is located in the Wood Green Shopping Mall. We are just adjacent to Boots, so you can enter through the entrance where Pret is. There's lots of local transport services through to the Wood Green Shopping Centre, and we're located on the ground floor at the moment. That's where you'll be able to find us opposite the post office.
Great. So thank you very much, Mustafa Hassan, General Manager at the CDC Wood Green.
Thank you for your time.
Good day. Thank you.